Hello, welcome back to our Pueblo Ankle and Foot Care YouTube channel. Hit subscribe and press the like button. We are happy that you're here. This is our video that talks about what we do at Pueblo Ankle and Foot Care for fracture care. Now, keep in mind, it's super important that we do everything we can, yes, to stay out of surgery, but at some point it's going to be something that needs to happen, possibly. If there's a fracture that is out of place, or if it's dislocated the joint, or if we have displacement of the fracture, significant displacement, then no matter what type of conservative care that we do while you're healing, you may, biomechanically speaking, in other words, your foot would not be right if we didn't do any kind of intervention to stabilize the fracture. And so when I'm talking about fracture care right now, I'm talking about non-operative fracture care. So when somebody is referred to us from the emergency room, or if you're coming just right from your home where you've sustained the fracture, then the first things that we do are we get a comprehensive history, and included in the examination part is getting some x-rays. And we try to get the x-rays while you're weight bearing as much as we can, because that shows us how that fracture is interacting with the ground when you walk. So fractures that we see typically in our office are not only digital fractures or phalangeal fractures, and that's these bones here that are part of the toes, but also the metatarsals. We see these frequently as well. Those, I would say, are our most frequently seen fractures. And so many of these, with how much energy is behind that fracture, many times these don't have to be fixated, they don't have to be taken to surgery. They can be put into a post-op shoe, and then also the acronym PRICE. P for pain medicine, R for rest, I for ice, C for compression, E for elevation. We put them on that regimen, and we decide whether the patient will be best served, depending on their age, with either crutches or with a knee scooter. Sometimes patients need to be non-weight bearing to the point that they need to use a wheelchair. But the majority of our patients, if they have the right combination of price occurring, the right kind of shoe, the right kind of offloading device, crutches, knee scooter, then many patients do fine with just Tylenol or ibuprofen after we've sent them out to rehabilitate. But the biggest medicine that we talk about with patients that have fractures is the key medicine, tincture of time. And this is a frustrating medicine to have, because you have to, it takes time, right, for any fracture like this to heal. And depending on your body, it could take a little longer, or if you're young and healthy, it could not take very long at all to heal. And one of the other things that we talk about for fracture care here in our office that can help speed up the healing process is laser therapy. Laser therapy is also really good for stimulating blood flow around a fracture area and can speed up the healing process. We have other modalities that are out there, like bone stimulators. Those we don't implement until about month 3 to 6, depending on your insurance coverage and what your insurance is willing to do. If you're at high risk, like if you smoke, you know, every time you puff on a cigarette decreases the size of your arteries and also how much oxygen is in your blood. And you need both of those to heal, especially fracture sites. Not just heal fractures, but any foot pathology. The feet are the furthest away from the heart, and we deal a lot with gravity with feet. So a lot of these modalities that we use to get people to heal better are really dependent upon your lifestyle too. So I hope this helps as far as what we do for fractures, and look forward to talking to you later.